Angiogenesis is a long story in non-small cell lung cancer. We know that it's a very important hallmark since the 70s from the first studies of Judah Folkman, and it became a very important target for treating patients with advanced non-small cell lung cancer at the end of the 90s, and in the next decades we had several studies targeting angiogenesis. This because angiogenesis is expressed in more than 40–70% of lung tumors, and we know also that patients expressing, for example, VEGF have a worse prognosis than patients without. And we know that all the signals of angiogenesis are promoting tumor growth, proliferation, and the creation of microvessels, creating then the phenomenon of metastasization. We have several receptors, and the most important receptor is the vascular endothelial growth factor receptor, and the vascular endothelial growth factor can be at least in 3 isoforms, and we have also several ligands called VEGF-A, B, C, and D, and we have also the 5th, which is the placental PIGF, which is another growth factor. Then we have all the downstream, and the downstream is very important to promote the creation of vessels. And this is one of the most important mechanisms for non-small cell lung cancer.
So angiogenesis is a hallmark of cancer. When the tumor is growing, a number of ligands stimulating angiogenesis are secreted by the tumor. These stimulate the endothelial cells, and this is crucial for the formation of new vessels. The reality is the tumor depends on the formation of these new vessels to growth, so all of this process is key in proliferation and also in the metastasis. There is a clear rationale to inhibit this process, to inhibit the angiogenesis, and this could be a good strategy in all tumors when we treat cancer patients.
Tumor angiogenesis has a lot of effects also on the immunosuppression. So one of the things is that the tumor angiogenesis is also based on immune cells. So the tumor secretes all kind of cytokines which cause immune cells to become also endothelial cells, so to say. And one of the difficult points is whether when we reduce the angiogenesis, whether the tumor becomes hypoxic, you could probably also imagine that the immune system will work less. And that's why, on the other hand, when we use these anti-angiogenic agents, we see that the perfusion of tumors is becoming better, so probably then there will be more oxygen, more nutrients, so the immune system can work even better. So it's quite a difficult field yet that we don't know what is the balance between the two. So on the one hand we have these tumor vessels which can, so the vessels in the tumor which can probably increase the immune activity, and on the other hand the mechanism on how these immunosuppressive cells occur in the tumor is also dependent on the cytokines released by the tumor. So it's on the two-edged sword in which we don't know what is the balance yet.